Chris, how about this? This working? Are you satisfied?
I'm happy if you're happy.
All right. Good morning, all. If you're looking for the Flat Earth Society meeting, that's down the hall. This is the American Academy of Biological Dentistry. You all know that already. Thank you for being here in Reno. You know, in the past we've met in Monterey, California, and from now on we're going to meet here. It seems to be easier for people to get here, and it's a little cheaper to stay. And you know, I know that Californians tend to be real uppity and arrogant, but you'll have to put up with us people in Reno here and the rest of the country. So anyway, thank you for being here. We have many guest lectures. This is going to be a very intensive 3-day course. A lot of the material is, well, most of the material is going to be very interesting, and a lot of it you probably don't want to hear, but it's our job to present this to you. The title, of course, is The Millennium Bugs, an Introduction to the Coming Plagues. We're going to be talking about jawbone infections, cell wall deficient organisms, Lyme's disease, among other things. I think you'll find it very interesting. I want to introduce the director of the American Academy of Biological Dentistry, Ed Arana. Ed started this organization years and years ago. As you know, he had a stroke a couple years ago that was devastating, and part of that was due to stress from the California Dental Board. Ed, would you stand up for us and say hello? Let's have a hand for Dr. Arana. Our goal is to carry on this organization for years to come based on what he's done in the past. Try to make this a learning education for you and try to keep you up to date and as much as we can with both science and maybe a little bit of metaphysics as we go along here. Dr. Klinghardt will be here sometime today. And if you don't know who I am, I'm Chris Husser. And I'm going to introduce the next speaker, who needs no introduction, Dr. George Meinig. He's going to be talking about numerous developments about the root canal therapy and the focal infection and 7 causes for the 80-year-old cover-up that was done by the dentist in our system. George, are you ready? There's some stairs over here.
Thank you, sir.
I got to put this microphone on here, okay? Oh boy. Oh, up here. Chris, is this okay? Can you hear him now from this?
Does it come across all right?
Yes.
Okay.
Thank you, Chris. I can't tell you how pleased I am to see the room full at this time of the morning. Oh, where's the... Oh, the slide. Oh, I don't have a slide thing?
This is forward, top one.
Dentists and physicians and the public as well are all in a deep quandary right now as to why in the world it has taken a full century for the extensive, outstanding focal infection research to continue and to be such an unsettled dilemma that it is at the present time. Fortunately, we are living in a new century, one that has already been labeled the information age. So much new research has come along which proves all that was accomplished, all that was accomplished 80 years ago, that I am pleased to have this opportunity today to bring all of these new developments to your attention. What will be revealed to you on the next page is Dr. A.C. Rosenau's list of 137 degenerative diseases discussed by him and reported individually in some 70 of his scientific articles that were published between 1915 and 1928. Most of these medical illnesses was found by Rosenau and his colleagues to be caused by tooth and jaw infections. That list has now multiplied significantly. Huh? Thank you. That's the list. I purposely didn't have Carol put it out there on the bench because I figured you would all be studying that list so closely that you wouldn't want to be listening to what I was saying. And so I have copies for all of you here, and as soon as I'm through today, I'll put them on the back desk so you can each have a copy of the list. But it's so tempting when you haven't seen the list before to notice all of the degenerative diseases that he came across in that period of time. No work. He's got to find somebody. Hold it down.
Should I darken the room more? Can you see that? Yes. Is that all right?
Who in the world would ever have thought that teeth and jaw infections could cause so many medical illnesses? During a trip to Germany in 1984, Ed and Carol Arana learned about the dental causes for a large number of these diseases. They came home to California and started the American Academy of Biological Dentists and presented seminars about this long-buried research. They invited German scientists with whom they had studied to conduct the next 3 seminars, and that started in May of 1986. In early 1993, because of my extensive background with nutritional treatment of degenerative diseases and my postgraduate training in root canal therapy, along with having been one of the 19 dentists who started the Root Canal Association, I decided to write Root Canal Cover-Up. You're probably mostly aware of that, but some people aren't, and it has to be said. That book reintroduced the incredible amount of focal infection scientific research that has been virtually ignored and buried for over 80 years. Oh, that's right. We're on the right one. This is a true story about how the fraudulent manipulation of medical research took place, even though the original studies had never been disapproved. This situation came about due to the misguided chain of events that occurred because of the failure of physicians and dentists to realize focal infections caused by root canal treated teeth, periodontal gum infections, and jawbone cavitation disease were all coming from teeth. The serious consequences of these degenerative diseases have actually resulted in millions of patients dying before their time. Most of you are aware that the research about focal infections has gone through some very turbulent times. In the 1990s, it was stated that the focal infection research was started 70 years ago. That would have been 1920. Actually, it all began in 1904 when Frank Billings introduced and named it the focal infection theory. In 1990, that means it started 86 years ago, not 70 years ago, as so often was stated. Considering it is now the year 2001, you can see that the focal infection research was actually started a century ago. My recent statements that it was 80 years ago, consequently, are in some error. There we go. Well, we have 3 great leaders. There have been many leaders in this field of focal infection, but the 3 who did the majority of the work were Frank Billings, Edward Carl Rosenau, and Weston Price. There were many other top-notch scientists, but these three were the outstanding leaders. They contributed by far the most research on this subject. More than a century ago has gone by since Frank Billings became acquainted with the focal infection problem in the 1890s. In 1915, he had presented the Lane Lecture Series at Stanford University Medical School. His work was immortalized in his 1916 book, Focal Infection. Billings was a big, very big, actual giant of a man, both physically and professionally. He served as the president of the AMA in 1902 and was recognized and revered as the great medical educator. Indeed, Billings was fondly remembered as the father of medical education in America in the 1900s. What happened is his schooling ended up in the 1800s, and he realized so seriously, as did many physicians, that medicine had to make a lot of new steps to get up to where it ought to be and the way it ought to be practiced. And so he introduced all of these things in the early 1900s, and that's why he became the father of modern medicine. Frank Billings graduated from Northwestern University Medical School in 1881. He served there as professor of medicine through much of the last decade. In the 19th century, last decade of the 19th century, subsequently he was professor of medicine at the University of Chicago for 2 decades, up until 1924. In addition to his professional responsibilities, Billings from 1906 to 1912 was chairman of the Illinois State Charities Commission. He was also active in numerous civic affairs, and he served as chairman of the Red Cross mission to Russia in 1917. The reason I'm telling you about the intellectual background of these scientists is that they have received a great deal of criticism from those who opposed us looking at the focal infection theory. And the Endodontic Association, of which I don't like to talk that unkindly about, still has been the prime one to speak in very depreciating terms of these scientists. And so you have to know a little about why they were as great as they really were at the time to be able to cope with the criticism you're going to hear from these people. In 1903 to 1904, Rosenau, where are we? We got the wrong one. From 1903 to 1904, Rosenau interned at the Presbyterian Hospital in Chicago. 1904 to 1915, he did bacteriology research and practiced internal medicine at the Chicago McCormick Memorial Institute for Infectious Diseases. He was a staff member there, and he worked with Drs. Ludwig Heckhoen and Frank Billings. From 1915 to 1914, he was professor and head of the Division of Experimental Bacteriology at the Mayo Foundation Clinic. Now you can imagine he's been accused of not knowing very much. How could you spend 30 years at the Mayo Clinic at the head of experimental bacteriology and not be a pretty smart guy? The third great scientist of these three world leading ones was Weston Price. From the time of Dr. Price graduating dental school, he spent half of his day's time practicing dentistry and the other half doing dental research. His expertise was so great that it wasn't long before he became known as a dental research specialist. His contributions as the third scientist of these three greats was 25 years of research all about root canal therapy. He documented those 25 years of discoveries in 2 huge volumes which contain 1,174 pages. Those who read Dr. Price's discoveries today report that these 1,174 pages, they will come away realizing he was truly the genius that they gave him credit for 80 years ago, and do even more so today. It's hard to get most people other than dentists to read those two books, but Price was an expert at putting down all of the things he did, and so you get a very good grasp of how accurate was his research. While not too many are familiar with Dr. Price's root canal research, most who do now, he is famous for his know now that he was famous for his nutritional studies around the world. Surprisingly, I personally did not learn of his root canal research until January of 1993. You will find that his unusual accomplishments will significantly prove to be of enormous value to you personally during your own particular lifetime. Here are a few of his credentials: Master of Science degree, Doctor of Dental Surgery, University of Michigan, Fellow in the American College of Dentists, published over 220 scientific articles and 3 books. The subjects included use of x-rays in dentistry, color problems in porcelain work, control of dental caries, correction of occlusion, and the lengthening of the bite. He was the first director of the National Dental Association in 1915 and was known as the premier dental research specialist of the world. At the time, we'll have to take you back a little bit, but most of this work started with Price and things during World War I. Now, if you look back at World War I and people going to the dentist, we all think of them getting the same kind of dentistry we get today. But just picture, dentistry at that time was still considered a trade. There were a number of smart dental educators and dental schools that were pushing to have the whole dental profession become a accurate profession. And unfortunately, at the time, we were pretty much just a trade. And so a lot of people, just picture, we didn't have, we had local anesthetics, but in those days, nobody was using local anesthetics to prepare teeth for cavities. And so people going to the dentist suffered a lot of pain with just the dentistry itself. And so consequently, a lot of them didn't ever go to the dentist. And so they had a lot of very badly broken down teeth, and it ended up with people having an awful lot of extractions. And they're going around snaggletooth and so on because none of them wanted to go to the dentist. It was always a painful procedure. At any rate, the Dental Association at that time was the National Dental Association. And the National Dental Association was watching what Price was doing, and they decided that if dentistry was going to ever become a true profession, they were going to have to start thinking of how dentistry related to the health of patients. And so they decided to start this research institute of the National Dental Association. And Price was named the president and managing director, and they had a list of trustees that you see there, and I won't read them all, but there's a whole long list of advisory board, and it's important that you know how many people were supporting all of this issue at the time, because this is what is depreciated. They say nothing was known about any of this. Well, the first was Dr. Victor Vaughn, Dean of the Medical Department at the University of Michigan, ex-president of the American Medical Association. Next was Charles Mayo, president of Clinical Congress of Surgeons of North America, and of course the surgeon who started the Mayo Institute in Rochester, Minnesota. Dr. William Welch, professor of pathology at the Johns Hopkins University in Baltimore, Maryland. He's president of the Board of Trustees of the Rockefeller Institute. Look at the background of these people. Now, I won't go on except to the third from the bottom. It was Dr. Truman Brophy. I can tell you about him because he was dean of the dental school I went to. He had been gone by the time I got into dental school, but he was one of the key deans of a dental school to push for dentistry going into being a full-blown profession and to get away from the trade status. And so when I was a student, we learned a lot about what he had done. This is a long list, and it's just that you recognize that these lists of people, these famous scientists from all over the world, were all at Price's beck and call when he was doing his research. If any of them could help in what he was doing, he would call upon them. And so this wasn't just Price doing these things, this was Price and all of these other people who were helping. Well, sorry about that, but why did Price do this? I have to read it to you. It sometimes his reading gets a little deep in feeling, but you'll understand why after I read it. With deepest gratitude and sense of the indebtedness for the devoted and loving cooperation and cheerful sacrifices of my wife and our deceased son, Donald, who at 16 paid with his life the pride of humanity's delayed knowledge regarding these heart and rheumatic involvements. This volume is lovingly dedicated. This is all Price ever mentioned about his son, but what he was saying is that he did a root canal for his son, probably in his early teen ages. I'm not sure just how old he was at the time. And Price, when he got out of dental school, pictures of the root canals he did were just as good as anything you see today. So he was no slouch at what he was doing with this. But you got a picture that when his son came down with a heart condition from the root canal he did, Price had not done all of this other research as yet. So he wasn't acquainted with what he would learn later on that could have saved his son. But he ended up, his son died of the heart condition that he had developed from that root canal. So you can see a little of why Price was so dedicated that all of his research be accurate and that all of it be of help to humanity, because he didn't want other families losing their family members either. Well, we lost the place here. Billings, Rosenau, and Price from 1904 to 1955 had spent 50 years between the three of them, and they accumulated between the three of them 100 years of focal infection research time. Imagine they were each doing individual research. Occasionally they would get together and do things together, but most of the time they were each doing it individually. All of those 100 years took place during that same 50-year period. And in spite of the extensiveness of the Billings, Rosenau, Price discoveries, their studies have been buried and ignored for almost a full century. Originally, when I wrote the root canal cover-up, I only knew of 2 causes for the burial of all of this work. And that was what I knew, and I printed that in the book. But in the 7 years since the book has been out, I have learned by looking through the research pretty extensively that there were actually 7 causes for the cover-up. In other words, everything compounded upon itself to get people, to get physicians and dentists to quit looking at the focal infection research. At any rate, there were 7 causes for the burial of the focal infection research. We'll go through those. Number 1, I wrote about, but a small group of physicians and dentists refused to accept the focal infection theory. Now here, go back, remember it's World War I, dentistry not too well practiced. People were getting mostly extraction of teeth when they went to the dentist. And so here you have an awful lot of people, the only dentistry they get is extraction of teeth. Some got other things, but most of the time it was extraction. And so this small group of physicians and dentists became very disturbed, and rightly so, that many people were having problems. Endodontic wasn't very popular then, but they knew about endodontics, and they started pushing the endodontic thing in order to be a way to save teeth. And of course, they didn't know the research that Price eventually came out with, that those teeth were always infected, and so that became a problem. Number two, Price, quite early on, had done a root canal for a patient of his who had done sewing as a business, and he had done a root canal and it had no problems with it. It was filled right to the end of the root of the tooth. She had no symptoms in the tooth, but Price was learning about these focal infections, and he said to the patient, he says, "You're going to have to let me take that tooth out because I got to do some research about it to prove to you that that's probably where your arthritis is coming from." She came down with arthritis so bad, she spent most of her time in bed. She could only get around in a wheelchair or crutches. And so she finally consented. At the beginning, like most people, she said, no, I don't want to lose that tooth. And so she put up with it. And finally she consented, and he removed the tooth one morning under surgical conditions, and he implanted the tooth under the skin of a rabbit and put in a couple of sutures so the tooth wouldn't fall out, put the rabbit back in a spacious cage that had plenty of good food and water, and he awaited developments. Well, it didn't take very long. Those of you who heard me talk before, I've showed pictures of this, and it's in my book, of the rabbit. In 3 days, that rabbit had the same arthritis in its limbs that the patient had in hers. And in 10 days, the rabbit passed away because of the infection that had come from that root canal treated tooth. And so this patient went on, and she slowly recovered and was able to again use her ankles and her limbs and her other things. But this caused Price to then do another thing. He said, well, if that degenerative disease caused this much trouble, look at all of those people that have all these other degenerative diseases that I'm seeing. Do you suppose root canals are giving them trouble? So every time he had one come in as a patient and they had a degenerative disease, he would suggest the removal of the tooth. And he would remove it and implant it under the skin of an animal. They used all kinds of different animals. It wasn't just rabbits. Rabbits happened to be an easier one to control in a laboratory situation, and so that's why he used the rabbits, but so much. But anyway, what he found was if the person had heart disease and they implanted the tooth, that person's extracted tooth under the skin of an animal, that animal very often got heart disease. It wasn't 100%. Many times it was a different kind of heart disease, but it was usually something had to do with the heart. If the animal had kidney trouble, by golly, the animal got kidney trouble. I should have said patient. If the patient had liver problems, then they would get liver problems. There was eye problem, they get eye. And in my book, you had a good example of an eye case in which this happened. At any rate, it was quite remarkable that so many times these things happened, and even though they weren't always 100%, the person always got some other kind of degenerative disease. And of course, what happened is that Price found that there were 20 different organisms involved in these infections in teeth, and that 65 to 85% of the time they were Streptococcus bacteria. At any rate, when this information first got out on about the arthritis cases, Price wrote an article that went to a medical journal and another one that went to a dental journal. And the physicians were so enthused about this, they grabbed right on to recommending people with arthritis to have infected teeth removed, either infected teeth or root canal filled teeth, whatever they had. And their results were generally favorable enough that they became very enthused about this. And pretty soon, a good many physicians were suggesting that people have all of their teeth out just as a preventive measure, somewhat like the physicians that do with a patient who has had a breast removal, and then they advise them to have the other breast removed because they might get cancer in it. And so it's kind of a real bad situation as far as what's happening to people. At any rate, these doctors advised so many extractions that this was adding to it, and it gave power to that small group of people who were saying, forget that focal infection information. We're having too many extractions already. You don't want to be extracting teeth for that reason. And so that's part of what happened with all of this. Well, then the third person was Percy Howe, who was a past president of the American Dental Association, and he professed admiration for Price's research work, except he disagreed that you could that a patient could have a dental infection and that it would cause heart trouble or any number of degenerative diseases. He just couldn't believe that an infection in a tooth could do that. And so he went out and he knew about Price's work with streptococcus, and he isolated some streptococcus from the saliva. He grew them in culture, and in the culture, he took the culture and then he injected it in a whole group of rabbits, and he waited to see what would happen. And lo and behold, not a thing happened. And so now he was really upset, and he said he wrote a long article in a dental journal and saying that Price was lying, that he was only trying to support his focal infection research by saying that these animals got sick and died and had degenerative diseases. He said, I did this and the animals didn't get anything. Well, he said that he knew about Price's work. What he didn't know was that Price had written long before that these bacteria that we're talking about that are friendly to us in a lot of instances do become pleomorphic. In other words, they change their form. They are able to learn to get along under the worst of conditions as time goes on. And so he didn't know that, and he didn't know that we're talking about a bacteria that has become an entirely different animal. And then shortly thereafter, this is towards the end of World War I when these things happened, John Buckley was another past president of the American Dental Association who also expressed admiration for Price's work, but he inveigled Price into a debate in which Price took the stand that root canal treated teeth ought to be removed, and he took the stand that no, they shouldn't be removed. Well, Price was no slouch as a lecturer, and of course he had all this research behind him, and he elaborated on a lot of the studies that they made and why they proved certain things were true. Well, Dr. Buckley was such a smart debater and public speaker, he never answered any of Price's charges. He never talked about any of the research at all. What he used was a lot of homey examples of why whatever Price was saying was incorrect or was implausible. And so he got away with that, and I never saw that there was any announcement as to who won the debate, but it was kind of a foregone conclusion that Buckley won the debate because of all of those crazy things he did, and he never answered any of the true charges that Price had made. At any rate, those two people caused the first really cut down on the information coming on about the focal infection theory, and that was towards the end of World War I. And at that time then, the sales of Price's two books fell to practically nothing. The invitations that he was getting frequently to speak to medical and dental groups fell off. And so this was fairly well closed down in the early 20s because of that. And then along the fifth one was in 1928. By that time, there was beginning to get some agitation back for the focal infection work, But along comes Dr. W.L. Holman, a bacteriologist, and he wrote a long medical article in which he fraudulently, unjustly criticized Dr. Rosenau's research, and he received much support from the endodontic leaders. And I knew most of those leaders, and I have copies of the articles they wrote because of what they learned from this man. And of course, I'm going to tell you about what happened in a minute, because there was another item 6 here that appeared. Next on the list was in the early 30s, penicillin was discovered. And once penicillin was discovered, then every physician and dentist learned that no matter what the person had almost, all they had to do is give them a prescription for penicillin or an injection of penicillin, and most of the time the disease went away. And so all of those physicians and dentists who would normally have thought about doing research about what caused the problem that they were anxious to treat, they no longer did that. And so we had a big change in trying to find cause just because we were giving antibiotics. And you all know how popular that has become and why it's now antibiotics are worn out from their usefulness. Well, let me back to the Holman affair. Hale Shackman was an individual who had done some health things for the government, and along the way he ran into Rosenau's research, and he started to study all of his articles. You know, Rosenau wrote over 300 articles in the medical literature in the 50 years he was doing this research, and Shack studied all of that. He was imbued with what he'd done, and Shack had a mathematical geniusness to himself. He who's that, but not everybody thinks mathematically like other people, and he thought so much of it. What happened is that Rosenau did lots of blood studies for patients and animals on everything he did, and there were a whole list of the different things that they studied within the blood study, and Price would list those page after page of what all those different responses were. Well, when Holman published the Price research in his book and was starting to criticize it as being incorrect, Shackman looked at the figures he was using. He says, some of those figures aren't Rosenau's at all. Where did he get them? Now, he had enough mathematical moxie to recognize that. Most of us just accept the figures and we go on. Well, he didn't, and so he now started to investigate, and he got the hold of the Holman article, and he investigated everything he could about it, and he eventually found that there was absolutely no research done by Holman at all. He had just pulled these figures out of the air in order to make them work, and he had ended up writing a book about this, and this book is available, and it's a very interesting one if you want to see how badly we can get screwed up by poor scientific background. The book was the Auto Medical Guide and Reference Manual by Stuart Hale Shackman. Well, about that same time, there were two scientists by the name of Shine. They were related. They were A and K, and they wrote an article, "The Importance of Trust in Science." And of course, most of us have had trust if we read an article. We pretty much believe that the research person did what he said he did, and that he wasn't falsifying things. We might disagree with what he did, but if we disagree with it, what we have as an obligation as a professional person is to develop a new research to prove that what was done before was incorrect and why it was incorrect. We can't just go along and say, we don't believe in this. We have to have reasons for doing that. At any rate, Shackman wrote that you can fool most of the people, but here's a new twist. How about falsely discrediting someone's valid results and then having a whole church built on that false discreditation? How about the home and church is modern dentistry? Don't forget to include modern medicine. A little extreme? Please read on. This story is absolutely true, and it does affect you. It seems so unlikely, so impossible, that anyone could have successfully executed so embarrassingly ludicrous and long-lived fraud as the Holman deception of 1928. It involved that manipulation of data to discredit the Rosenau research results. He could not honestly do so then, and still today, no one has refuted it. The Rosenau research has repeatedly been scientifically confirmed. Nonetheless, Holman's deception still continues to play a decisive role by it being repeated in the scientific literature over and over and over again by unsuspecting doctors. In a way, this fraud is contributing to the needless suffering and the early demise of millions, insidiously and persistently infecting the literature of medicine and dentistry like a modern computer virus. Yes, there is a terrible virus loose in the history of medicine and dentistry, and it's time to expose it and eradicate it. Scan the literature for the Holman virus. It is everywhere. The sad truth is that the correcting of the literature is no simple task, as the implications of medicine and dentistry in general are major and pervasive, and in the case of the field of endodontics, terminal. As drastic as this sounds, it is not an overstatement. In a sense, it is an understatement. The terminally implicated field may not be merely endodontics, that is root canal therapy, but rather the whole of modern dentistry. Scientific confirmation, Shackman, fraud and fallacy of root canal therapy, Institute of Science, preliminary technical report. Well, can the Root Canal Association ever survive problems like this? There's some big question as to whether they ever can, but we do have to have some kind of hope that maybe someday somebody will find a way to be able to kill those bacteria in the dentin tubules and to get rid of the toxins. So far, we know of no way that that can be done. And in spite of the fact that you hear about a lot of different things that are going on, that has never, none of them have ever been proved to be successful. Well, dentists and physicians know about focal infections. Unfortunately, what dentists and physicians don't know is that 95% of all focal infections come from teeth and from tonsils. And now we'll go on to the second section now. If we move it up to that other group, we'll get on with the next part of this. There's been so much here. I hope you'll forgive some of the stumbling I'm doing trying to put this together. I've been working on it for 2 months, trying to weed it down and have enough time to complete it all here, and it's been a most difficult task I've ever been through. At any rate, this is a special health report. The most distinguished medical discovery of the 20th century is the role of teeth and jawbone infections is causing 95% of focal infections, will free you from unnecessary pain and suffering, and can even save your life. That is by recognizing the teeth are such a big problem with all of this. There are 8 major new contributors whose work substantiate and prove the century-old focal infection research. And we'll just read those quickly. Joseph Issels, Ed and Carol Arana, Christopher Husser, Diedrich Klinghardt, Jerry Bacot, Hal Huggins, Boyd Haley, Bob Jones, and there's undoubtedly a number of others that I should be mentioning here that have slipped my mind. So if you think of any, write them on the back of your card, the name on the back of your card, and I will add them on, because I'm in the process of putting out a new book with all of this, so that you'll get all of the information in a little clearer form than you're getting it this morning. Joseph Issel was a key person for us because he had the highest success rate in the treating of cancer in Europe. He established the first European hospital for incurable cancer patients. And 40 years ago, in that hospital, he was, and to be successful with cancer, he was demanding the removal of patients' root canal treated teeth, jawbone cavitations, and amalgam mercury poisoned fillings. And so he did this for 30 years, and then he retired, he sold that hospital, and he moved to the United States and eventually to the San Diego area. He was born in 1907. He passed away at 91 years of age just a few months back. It must be 6 or more months ago. Now, his wife, Ilsa Marie, continues the ISL Foundation, and a more recent book, Cancer: A Second Opinion by Avery Publishing, is one that he has done. Well, Ed Arana, where are we? Oh, this is ISL. Just one look at him, you realize what a high professional individual he was. Ed Arana, of course, is known because of his start of the American Academy of Biological Dentistry, but he was doing a lot of these things before he ever got onto that. And let me just cover a couple of things. In 1984, Ed and Carol went to Germany knocking on doors, and they checked out homeopathic manufacturing companies, they checked out dentists and other scientists who were doing things along the lines that we're talking about today. And he came back to California, and in 1985, he and Gary Verrigan each put up $1,500 and started the American Academy of Biological Dentistry. Well, the first 3 meetings happened then in 1986, 87, and 88. And each of those 3 meetings, he brought different speakers from Germany to help bring to us what was going on in Europe about this, because they were more advanced than most places in this country. Now, other people have done lectures on these subjects, but Ed was the first one that had an organization do something about all of this. And so I won't, in your handouts today, you have a list of all of this, and I would suggest you all read this list of what they have done, because it gives you a rather broad aspect of how far we have come in this last number of years, partly because of what Ed and Carol Arana have done for us. I got a little sidelight I have to tell you about that. After my book came out in June of '93, I got a call from Ed, and he says, "George, I understand you wrote a book." I said, "Yeah, I guess I'm guilty, Ed." He says, "Is it any good?" Then I was stumped. I didn't know what to say. And then I thought that I'd just gotten a letter from Hal Huggins, a short letter complimenting me on the book. And I said, "Just a minute, I know you know Hal Huggins pretty well. Let me read to you what he just said to me." So I read the short letter to him, and as soon as I stopped, he said, "Send me a case." He didn't ask me the cost of the book. He didn't ask me how many books in a case. He just said, "Send me a case." Well, I, of course, was thrilled to sell a case of books, and thought that would be it. Well, in another week, I got an order for another case. And then from time to time, he was ordering more cases, and I thought, what the devil is he doing with these? Well, of course, I eventually found out he was making them available to all you people that expressed interest in the American Academy of Biological Dentistry. So that's kind of my background with that part of it. And look who we have here now. Oh, Chris Husser. I shouldn't have to say anything about his background, but he's the worldwide leading oral surgery lecturer regarding the root canal extraction protocol and the surgery for jawbone cavitations, and the leading physician in the world in the treatment of Lyme disease. And one of the problems with the Lyme disease is that many physicians in treating Lyme disease are not aware that many of these people also have root canals. They also have cavitations. They have up to 95% of problems all listed dentally that could be complicating the treatment of their Lyme disease patient. But if they don't know this, they're never going to be too successful with this. And one of the reasons Chris has been as successful as he has is he understands this part of it. And then we have Diedrich Klinghardt, who's going to be here eventually today, I guess, leading American European teacher of neurotherapy, removal of toxins caused by root canals, and of mercury accumulation from silver amalgam fillings. Now, I'm not going to spend time. Most of you people know this, and time is running out, so I want to hurry through. You can pick up Jerry Bacot's background. If any of you are not aware of his biopsy service, when you take a tooth out, you better get on his biopsy service and see that it is sent to him for analysis, and also send some of the infected tissue that surrounds that tooth. Or if you do cavitation infections in the jawbone, that you send the biopsy material, and you will end up getting a report from Dr. Bacot as to what the organisms were that were involved, a tentative diagnosis for what has gone on, and in effect, what Dr. Bacot has been able to do is to show that now when you take out one of these teeth, the bacteria or the organisms that are showing up on your patient is the same kind of thing that was being talked about 80 years ago by the three great scientists on the focal infection situation. And so he has done a great deal to prove everything that's been happening. Hal Huggins, you're all quite aware of. Many of you may not be aware that he was presented the two huge Price books documenting his 25 years of root canal research from a personal friend of Price's. This personal friend of Price's was given these two books, and Price has said to him, now, don't let this work die out. You know, he says, you keep it alive. Well, the man did let it die out, except that one day he spotted the two books on his shelf, and he says, my goodness, I didn't follow up for Price on this. And he said, but the name of Hal Huggins came to mind because he had heard Hal Huggins speak a lot of times, and he mentioned Price very often because of his nutritional work. And so he says, that's the man I'm going to send those two books to. So he sent his two books to Hal Huggins, and Hal Huggins got them and he couldn't put them down. He was up till 2 or 3 in the morning reading them. And finally, he almost immediately started to repeat the Price research using guinea pigs instead of rabbits. And he had a couple of meetings reporting some of those results early on. But it's one of the reasons he talks a fair amount about these factors. What happened is that after he had read the books, he called up Pat Connolly, the director of the Price-Pottinger Foundation, and he says, Pat, what's the matter with you guys? You never say anything about Price's root canal books. And she says, what books? She said, I never heard of them. And he said, you better go into the archives and look it up. Well, the foundation has more than a room full of all of the original Price research material. And so that afternoon, she dug right into there, and lo and behold, on a bottom shelf, all covered up with all kinds of other stuff, were these two books. And so she grabbed them and took them home and started to read what she could during dinner hour. And after dinner, she called me on the telephone, and she said, George, she knew, of course, of my root canal background. She said, you're going to have to read these books and make a report to the board of directors of the Price Foundation I was also a board member there. So I said, well, that makes sense. But she says, you know, this work was done 70 years ago. It may not be viable now. You better, you know, let us know whether you think this is worthwhile or not. And of course, the same thing happened to me. She sent the books to me, and I got them in January of 1993, and I couldn't put them down. And I was up till 2 or 3 in the morning until I read them. And then I read them a second time, and I was trying to decide who could I get to write about this and blow the whistle on this whole business in the medical and dental profession. And I couldn't come up with anybody, and I kept thinking about the fact that about everything I had done in my life kind of trained me to do this, so I decided I was the one that was going to have to do it. And it was somewhat reluctantly, but I did that nevertheless, and you know what the result of that's been. And then we have the number 7 is Dr. Boyd Haley and his new test. I think most of you are probably aware of that. Is Boyd Haley going to have a booth here today? Anybody know? He often does. If you're not acquainted with it, look it up and follow it out. He's the head of the chemistry department at University of Kentucky. Professor of chemistry, developer of the new affinity labeling technologies incorporated that discloses severe toxins present in periodontal pockets, root canal treated teeth, and jawbone cavitations. He's at head of the department at University of Kentucky, the College of Pharmacy in Lexington, Kentucky. And this is all the company, and the test is not.
Not right in the microphone, George. Make sure you're mounted right in the microphone. Thank you.
That better?
Yeah.
Thank you. You want to be acquainted with this. One of the things that's happened is he has been able to prove the very thing that Price came out with 70, 80 years before with about the toxins coming from bacteria. Price did a study that would, to this day, I don't know how he managed to even do it, in which he separated the toxins that came from the bacteria and the bacteria. And he took the bacteria and injected it in one group of animals, and he took the toxins and injected it in another group of animals. And lo and behold, the animals that got the toxins got sick quicker and died sooner than those from the bacteria. And so he was the first one that reported really that how serious the toxins of bacterial organisms can be. And now Boyd Haley is confirming this with this alt test that he has now, because he finds toxins in very many of them. And then we have Bob Jones, who, because his own problem with health, of having numbers of root canals, amalgam fillings, cavitations, was in terrible health, and in trying to solve all of this, he became so imbued with all of it, he used his engineering and his ability to design the cavitat. And so I suspect he's supposed to be here today, and you'll probably want to find out a little about what he's been doing too. The press has routinely been not too sharp at reporting dental things, and you know it's been practically impossible to get them to report anything on root canal therapy. But way back, I think it must be 25, 30 years at least, the Heart Association stimulated the Dental Association and the Medical Association to have every physician and dentist prescribe antibiotics to any patient who was going to go to the dentist for any dental care. And the reason for this is that they found that many patients who had heart conditions to begin with ended up getting bacterial endocarditis, because when the dentist was doing dental care, he often stirred up the bloodstream in some way, and there would be bacteria involved, and those bacteria were a focal infection site, which carried on the whole focal infection theory that we've been hearing about, and causing a key factor. Well, every dentist and physician is known for, I don't know, 25, 30 years, I'm not sure how far back it is, about this, but on July the 14th of 1997, the Heart Association came up with new guidelines for treating patients at risk for bacterial endocarditis. And here the ADA News, the ADA News here had published that. It was a startling factor. Now, the one that really threw me for a loop, knocked me off my chair almost, when the ADA journal came out, and on the editorial page, I see the sign, focal infection back with a bang. Well, I couldn't believe it, that this was coming out of the ADA. And then, if you'll look down on where it says editorial, got to read that because you have to know the status of the ADA in some of these things, and I was surprised they even mentioned any of it, but here's what they wrote, what the editor wrote. Dentistry has been virtually excluded from these lifelong press announcements. The media, rather than promoting quality of life enhancements that can be achieved from a dental visit, have focused on the dirty water lines and the potential dangers of dental materials. Well, dentistry's time to shine may have arrived. Research has identified periodontal disease as a major risk factor for cardiovascular disease, CVD, and stroke. It even may be a risk factor for the production of low birth rate babies. While this subject has received some press coverage, a major public response has yet to surface. But it will. It's only a matter of time until one of the major TV networks does a showcase piece on how a trip to your dentist could be a lifesaver. After all, periodontal disease can be cured. With more than 1 million people dying each year of CVD, the prospect of prolonging life through a few trips to the dentist should motivate millions of Americans to queue up for their periodontal treatment. Insurers of dental care will have to redefine their benefit packages. Dentists, especially general practitioners, will have to expand their capacity to treat periodontal disease. It is interesting to me that the ADA editor is criticizing the press for not carrying this information to. Isn't that the job of the ADA? I was just utterly flabbergasted that they're pushing the cause to somebody else. Now, this is an article that was written by Hubert Newman, professor of Department of Periodontology, Eastman Dental Institute and Hospital, London, England. This article appeared in the Journal of Dental Research in 1996. This is 3 years after my book came out, and it's titled, interestingly enough, Focal Infection. Well, I was so pleased with all of the things that Dr. Newman wrote, but the thing that really impressed me more than anything was this part here, where the bibliography, 74 references from the 1970s. Oh, I'm sorry. I'll do it from here. 74 references from the 1970s and 1980s, 68 references from the 1990s to the 1996, with a total of 142 scientific references since 1970. And we keep hearing there isn't any new information on any of this. Nobody knows anything of what's going on. Here he's listed 142 of them, and that isn't all of them by any means. Then USA Today had this out, and you know USA Today is a large newspaper. In order for me to get this slide, This heading here traveled clear across the top of the page. I had to cut out some stuff that was in between here in order to get it on a slide so you could see it. The other things were about the other news items that were in the paper. Clear over onto the right side was this in color. This square was in color. And mind you, this is the top of the front page. And these teeth are snow white. And this that looks black here, that was pink because it was reflection from the gum color that you're seeing in here. Well, it was most startling. And on the front page, they had some introductory remarks about what was going on here. And then they referred you to a page later on in the paper. And lo and behold, I thought this would be a short article. It covered almost 2/3 of the whole page, all about focal infections and how these dental things can be a problem. And so I was really floored that a newspaper of the size of the USA Today would have done something like that. And then the LA Times, about the same time, this was February 26th of 99, wrote this article on study that links heart disease to bacterial infections. We've already mentioned periodontal disease, and you're already aware of that. I won't go into that, but it's quite amazing that you can do tests of the periodontal pocket and find the bacteria that are going clear into the tooth from the periodontal pocket, and you want to get in touch with all that information. There's really not time to take up going into cavitations, but there's always some people in the audience, and very many dentists don't know what cavitations are at all. This was introduced actually by dentistry's great pathology writer, Dr. G.B. Black, back in 1915, and yet very few dentists are aware of cavitation factors. But fundamentally, what a cavitation is, that everyone knows that they have a hole in the tooth, it's a cavity. But what happens when they have a hole in the jawbone, that's called a cavitation. And people have a hard time kind of getting that in their head of just what it is. And cavitations can, in the beginning, even be sterile, but most of them do become infected over a period of time. And so there's a lot of information out on that, and I won't take time to go into any more of it other than to make that brief mention of what was going on. Well, here's the number one, and this was Dr. Bocot's study. This is a cavitation, folks. Those of you who have never seen this picture. And this is a hole in the lower wisdom tooth area, lower third molar area. And this is a hole in the jawbone. And this is all dead cells. And those dark brown, turning to black cells that are out in here, those are the dead bone cells that are occurring from that area. And then if you look closely, you see there's even some beginning breakdown of the mandibular nerve here. And if you look closer again, you see some dead bone cells clear around underneath and around it. And these cavitations, when they get large, often do that. And you can have destruction of that mandibular nerve. Most of the time, people end up with some numbness of the lip for a while, but a lot of times they recover. But this is a key picture. And the reason that this came about in the first place is that this man had trigeminal neuralgia. And as most of you know, the books say no known cause, no known treatment for trigeminal neuralgia. And the treatment that they do perform is severing some nerves in the face. But when they do, the patient is left with a very grotesque appearance because they can't use the muscles of their face like they would normally do. And so many of them want to avoid that kind of affair and don't do anything about it. Well, when this man had his trigeminal neuralgia for 8 years, and he decided to commit suicide, and he wrote a letter to Jerry Bocot, who he'd heard about, and he said, Dr. Bocot, I'm going to will my skull to you. I want you to do a autopsy study of it and see if you can find out why I had this terrible disease, and maybe you can help some other people. Well, Dr. Bacot found this large area, and he then investigated numbers of other people, and he reported it, and because of his reporting of it, a number of people with trigeminal neuralgia had cavitations removed, and he reported that roughly 70% of those who had these removed recovered and no longer had the pain from trigeminal neuralgia. So this turned out to be a cause and effect affair almost immediately. Missed a page here. Here we go. There are 7 causes for the 80-year-old focal infection business, and I covered those earlier. What I'm going to cover now is the American Association of Endodontists pamphlet or brochure that they put out and sent to all of their members and any person who requested from them information about focal infections. And this was the, oh, wrong place. This was the title on top of the page of the American Association of Endodontists. Background information on focal infections, September '93. And then, forget this business, you go down to paragraph 4. And on paragraph 4, it states, there is absolutely no modern evidence that supports claims that root canal treated teeth serve as an infection foci. And now this is really a scientific paper put out by the Endo Association. Now I can testify to the fact of that. I received that as a life member of the Endo Association. I get the journal every month. I have to pay a yearly fee to do it, but I get it every month. And from time to time, they would mention that there was no substantial evidence of this. So this wasn't just an accident, but I don't think they publish it anymore, but at least they did for a period of time. And you can see how far off base they were with all of this. Well, that may be as far as it'll go. This really completes what I came here to present, unless you want me to spend any more time on going over some testimonials. I don't think we're out of time, aren't we?
You have about 5-7 minutes.
Oh, I could do some testimonials. People, all of you who have been doing these things have got almost as many testimonials that I have, I'm sure. But I've got a few that are kind of interesting that you might like. After a root canal treatment, J.W. in 1996 wrote to me, I developed kidney problem. My doctor was concerned and referred me to a dentist who said the tooth should be removed and the socket deprided to get rid of the infection. It felt better right away after the tooth was removed and the socket cleaned out. Kidney tests showed the infection had disappeared. And then Mrs. C.T. in June of '95 wrote to me, had root canal in upper front tooth. Procedure was a horrible process. I had to go back for treatment every day or two for 2 months. Pain in the tooth was awful, and it was still sensitive after 2 months. 9 months later, had to have a hysterectomy to remove an ovarian cyst. I can't tell you the number of people who call me and tell me that they've been having severe pain and difficulty after having had a root canal done, and they go back and the endodontist or the dentist who did this for them say, oh, the x-ray doesn't show anything wrong. There can't be anything wrong. It must be in your head. You know, they figure out some kind of an excuse. They just grin and bear it. It'll go away. Well, these stories are much too often. And from Dr. Coolidge, who was my mentor and professor in this subject, he told us originally in learning about root canals, if the patient's having any problem, you still have infection there. The chances are it's coming from the lateral accessory canals, because there's no way of you getting in there and treating those anyway. And so there's a very good chance that they're having a problem there. And so if they're having trouble, you better tell them to take the tooth out. And so what we were taught to do is if a patient had an infected tooth, we'd say, well, you have two choices. We could try and save it by doing root canal therapy, but that doesn't always work. But if it doesn't, well, then you have to take the tooth out. Or we start out by taking it out. Which do you wish us to do? And that was the way I practiced dentistry for 47 years. So I did several thousand in practice, and so I know how that goes. At any rate, with this woman with her front tooth, there's a special note, of course, that some of you are quite aware of. The front tooth is on the genitourinary acupuncture meridian. During his 25 years of root canal research, Dr. Price found that women having root canals frequently developed serious diseases in their female organs. And he reported this extensively in numbers of cases. I think there was 5,000. I'm not sure I've got the right number, but I think he studied something like 5,000 people. A man in Hawaii had 2 root canals. They were never right, always sore and painful. Health had been fragile for a long time, had staph infection in ankle and large swelling, had tooth removed and all pain gone, and the ankle swelling disappeared the next day. But here's the one that got me the best, probably. Woman called me from New Zealand to California, and she said, Dr. Meinig, I had a root canal done a while back, and she says, I am a professional singer. And she said, right after that, I lost my ability to sing. She said, my speaking voice has not changed any, and I could tell on the phone she sounded perfectly normal. But she said, is there any possible way that this could be coming from the root canal? And so I said to her, I have never heard of a case of this kind, but I think it is very possible, because the tonsil area drains infection from a lot of areas of the mouth in order to get rid of it. And in doing that, it could have affected, the tonsil area could have affected your throat in such a way as to change the way your singing voice comes across. Well, a month later, I got a call from her, and she says, you'll never guess what happened. And I said, no, tell me. And she said, I had that tooth out yesterday, and my singing voice is back today. So that was one of the best stories. Mr. J.K. from Israel, he advised me in very broken English that he had jogged 3 miles a day for 5 years. And after he had a root canal, his knees and ankles hurt so much that he could hardly walk anymore, and he certainly couldn't jog. And he said he recently had read my book, and then he had his root canal tooth extracted, and the next day he jogged a mile. That's a little hard, to picture, but people keep reporting these things, and it's what happens. And the key one is my own mother, who had acute rheumatism, and this was my 2nd year of practice, and she had an upper cuspid that had a root canal in that was done many years before. It was right to the end of the root of the tooth. No sign of any infection around the tooth. She had no symptoms in the tooth of any kind. But she developed this very severe rheumatism, and we had a physician who went to Germany every summer for a month to study in Germany, and he was a real sharp guy, and I would talk to him from time to time because she wasn't getting any better. And finally I said to my mother when she was having another bad day or week or whatever it was, I said, we got to get that tooth out. And I called the physician and told him what I wanted to do, and he says, okay, go ahead. And I took her down. I was practicing in Evanston, Illinois then, and I went to Chicago College of Dental Surgery, so I went down to the oral surgery department. I knew the oral surgeon quite well, And I said, hey, you got to take this cuspid tooth out for my mother. Well, I didn't know anything about what we're talking about now. We didn't know anything about going in and cleaning the socket out or anything else. And I don't think he found anything at the end of the socket. I don't remember anymore. At any rate, she had the tooth out, and 2 weeks later, she was up and around. And so I had that personal experience with my own mother. And it was very early in my practice because I started in practice in 37, so that was in 38 or 39. And so I lived with that for a long time, and I knew that you could have it. And the reason we could have it, Coolidge said, remember you can have infection in those lateral canals. And that's probably where it's coming from. Well, one last one. This man had an irregular heartbeat, and he went to an excellent alternative physician in the Seattle area, and he was advised to have a pacemaker made. The patient said before he wanted to put that in, he wanted to consult with a friend of his who was familiar with these things. And so he talked to the friend, and the friend said, oh, have that upper second molar of yours removed. That's on a heart meridian, and it could be the problem with your heart, and so on. And so he did that, and he had the tooth removed, and a week later he was at the MD's for an appointment. So I guess the MD had gone ahead to make the pacemaker. And the physician says to him, what in the world have you been doing? You no longer need a pacemaker. And so this was really something. At any rate, I thank you very much for your attention today and for being so kind. I apologize for the stumbling in different places. This has been quite a chore to put all of this new material together, and I'm intending to put it together in a book form so that it is clearer and with less problems than what you're seeing here today. Thank you very much for your help.
Don't go away, don't go away. There'll be some questions.
Oh, hey, good.
And tell me to write a new book. Tell them about your new book.
Okay.
Any questions for the granddad of our profession? Michael?
When does George plan on having that book out?
I had planned to have it out now, before now.
Also, if you want to see Boyd Haley's reports, you go to the Cavitat table. They have
Okay.
about 35 of them in a booklet that will show that toxicity.
I didn't catch it.
Speak up, Michael.
The Boyd Haley results of tests, I have 36 or so sites that I've done on surgeries that show Boyd Haley's results that you were referring to.
Yes.
And on the other side of it, many of them have the histological report from Jerry Boco, and I should have a paper out on that.
Wonderful. Could you send that to me?
Yes, and it will collate it to the Cavitat.
Thank you very much. That will help. I think I mentioned I'm in the process of putting all this together in a book. It's come along about 6-8 months ago. It suddenly dawned on me. I knew that the 7 reasons for the cover-up, I'd only published 2, and yet so many people don't understand how could this work have ever been postponed. And I thought, well, I ought to write about that. But here, just about 6 months ago, I suddenly discovered how much new research had been reported in the scientific literature in the 7 years since my book has been out, and some before that. And actually, I think I told you that in maybe I didn't get that, maybe I didn't do that in the election. 1963 to 1997, there were 1,472 scientific articles published in the literature all about this subject of root canals and cavitations and what have you. And these are from mostly dental scientists and others who are interested in the dental problem, physicians in some cases, from all over the world. And there were some 800 of them came from the United States, and the others of the 1,400 came from other parts of the world. From 97 to 99, they reported an additional 75 articles. So it's now 1,500, I don't know, I think it's 1,574 articles that are now in the literature. If you want to go to Medline on the internet, under the title Focal Infection dash Dental, they have 2 large discs with those first 1,400 and some, and I don't know how you get the other. You probably just request the other from 97 to 95. I had friends do that and send it to me, and what I did was I took the disc to Kinko's and had them published. And I got this, and it's not the articles, it's the titles of the articles and summaries of the articles where they had them. But there's so much, you know, when you get 1,400 articles, you got an awful lot of data. And I haven't had a chance to read all of them yet. I've read more than half of them, and fundamentally they're all covering this subject in most kinds of ways. Dr. Whitaker.
Should we eliminate root canal? And if so, what do we do to replace it? I'm not a dentist.
That's Dr. Whitaker, her specialty is
Yeah,
walking
and
above. She said, should we eliminate all root canals?
The research shows that all root canal treated teeth always remain infected, no matter how good they look or how good they feel. I covered this pretty thoroughly in my book in the fact that Price showed this. Price was the first one that showed a picture of a tooth from a microscope of the dentin tubules with bacteria present in them. He was the first one that ever did that. And thereafter, there were many people who did so. And in my book, I showed some later on modern pictures with electron microscopes, which show the bacteria much enlarged and tubules much enlarged. And you have to face the fact that those bacteria are coming via the lateral canals from the dentin tubules, via the lateral canals into the periodontal membrane, from the periodontal membrane into the surrounding bony socket, and that from there, those bacteria metastasize in the bloodstream to any gland, organ, or tissue, just like a cancer cell will, and set up a whole new infection. And this is where these degenerative diseases come from, is because when the patient has it, they get a very good immune system. They can tolerate these root canals for a period of time, and they think the root canal is fine. Actually, they're not fine at all. What's happening is 24 hours a day, those bacteria are escaping into the bloodstream, and the immune system has to get rid of them. And what we're quite sure of now is that some of those immune cells actually just get worn out and can't work as well as they used to do. Now, there may be other reasons, and maybe they get infected in some kind of way. We don't know that either. There's an awful lot has to be learned about the immune system. But we do know that eventually the person has that happen. What Price reported on a whole flock of cases in which people started out very good, with very good immune systems, but he said if they got into a case of stress, an accident, death of a close family member, a case of the flu, something like that, now their immune system, which had been protecting them and doing a good job of protecting them, now it would no longer be able to do the things it has with this new stress, and now they would come down with a degenerative disease. And so the end result of this, you know, with a degenerative disease, easiest one to think of is heart trouble. You know, people with heart trouble, physicians do a pretty good job of keeping you going, but most people with heart problems die before their time. And this is true of all degenerative diseases. Eventually, no matter how good the medical treatment is, it happens. Well, most of the medical treatment isn't very good because the physician doesn't find out that part of the cause that's involved in what's going on is the root canal that person's got, or it's the cavitation that they've got, and now that's pulling down their whole immune system, and eventually they come down with something. And so we're all subject to this in so many different ways that practically every person in the room is going to have some connection with these things.
Don't forget, Sunday we'll have a panel discussion, so you can ask more questions of George then. Why don't we take a break till 11 o'clock, and that's our next lecture at 11 o'clock. Thank you, George.
Thank you. Thank you for
Good
giving
job.
me so much time. It was wonderful.
Perfect. Worked out well.
Wonderful.
Perfect. No, you're right on time.
Yeah, wonderful.
Okay.
It
Good stuff.
worked out fine. I can't tell you how I sweated that out to try to
You
get.
did a good job.